It's always recommended that the ADA recommends people come in to the dentist every 6 months, and that's for cleaning and checkup. We got to make sure things aren't changing. We take x-rays at least once a year to make sure that we're not missing anything under the surface. The concern would be if you have gum disease or something that, even having braces on, you may need to be seen a little bit more often than just that twice a year. You don't have to come in more often unless we start seeing changes in your health. That's one of the things that's really important, that you come in on a regular basis, like that 6 months. But if you start developing gum disease, if we start getting dry mouth that leads to more cavities, then we may need to see you a little bit more frequently, or look at changing our daily routine of how do we take care of your teeth at home. Twice a year, unless we have that predisposition for gum disease. If you're diagnosed with gum disease, if you need that deep cleaning, then usually you'll need to come in every 3 to 4 months. I always tell my patients brushing and flossing is number one. Anything else is just gravy on top, right? Using a water pick, using a mouth rinse, using a tongue scraper, anything like that is just extra icing on top. That's great, but those are the two basics. If you can just stick with those two, you're right on track. Congratulations. And so what you'll do is, as soon as you start seeing those little teeth under there, that's when you want to start coming into the dentist. So usually that's around 6 months. And the goal for that is, how do you keep them clean? Formula, breast milk, any type of food that you're feeding your baby does have sugar in it. And so you want to make sure that we're at least using a wash rag, if not a little baby toothbrush to clean those. The big thing about those early visits is talking to you as a parent, to educate you and talk to you and get them familiar with the dental office. But really the big thing is for the parents to make sure that you guys are educated well. Sure, yeah, so ideally, yes, you get in there as best you can. The baby's gonna cry. When they cry, their mouth is gonna be open. So yeah, you'll be able to see a little bit better. And then the more you do it, the more they'll get used to it. So yeah, if nothing else, get in there with just a little wet washcloth and get in there and wash their teeth off with that. If you can get a toothbrush in there, fantastic. They make a lot of baby toothpaste. I recommend toothpaste that does have fluoride in it, even at that early age. No, they can't spit, but if we get in there with the fluoride toothpaste, a small grain of rice size toothpaste, it's really important at that early age to reinforce those teeth with the fluoride. Sure, so the first thing I'm gonna ask you is, what kind of toothpaste are you using? A lot of toothpaste have additives in them, and so that extra additives can actually be abrasive, really harsh on your teeth, and so sometimes that causes a sensitivity. Also, what kind of toothbrush are you using? If your toothbrush is too hard, sometimes that can cause some sensitivity. So those are the first questions that I'm thinking of. Another one would be, are we using any type of whitening agent? Whitening can cause a lot of sensitivity as well. But at home, if you want to try it before you come in, I would just use some Sensodyne toothpaste or any type of sensitive toothpaste, and really a soft toothbrush. Switch over to those first and see if that doesn't help you. Sensitive teeth, we've got a lot of tools in our bag to treat sensitive teeth, but it can be caused by a lot of different things, from clenching or grinding to toothbrush habits to, gosh, it could even mean that you have a cavity. So really need to look at, I'd love to talk to you and see if we can talk about that together to figure out what's causing that sensitivity. The first thing I'm going to tell you, if I can't figure out any one thing, is let's try that sensitive toothpaste. So that's a good thing that you can do and try at home. Yeah, so you want to call your dentist right away. The best thing that you can do actually is to find the tooth. If it's intact, you want to actually put it in the kid's mouth. If they're too young, don't clean it off. If they're too young and you think they're going to swallow it, another option would be to put it in your mouth. Another option would be to put it in a glass of milk, or You know, if nothing else, you want to put it in a cup of water to keep the tooth from getting dehydrated. Do not try to clean it off. Do not try to take any of the dirt or debris off of it. Once you get a hold of your dentist and you get into either an emergency dentist or your dentist, they're going to try to reimplant that tooth and splint it into place. Long-term prognosis of the tooth isn't great, but if we can get 5 years out of it, then fantastic. That's what we're gonna do. So the best option is to really try to find that tooth and put it back in. Now, if it breaks off, we're looking at a different issue, but you always want to try to find that tooth and bring it in with you. So the first thing I'm going to recommend is that you come in to see us. A lot of times bad breath means that you need a really good cleaning. The bacteria in your mouth, just like the old food in your refrigerator, starts to smell. So the bacteria in your mouth needs to be cleaned out. We need to make sure that there's not gum disease that's causing that bad breath. If you see a dentist on a regular basis and are still having that bad breath, ask your dentist about, hey, tell me what my options are. And I would tell you, yeah, let's look at a tongue scraper. Let's look at, possibly fluoride toothpaste, or like maybe a sensitive toothpaste. Are you using a mouth rinse that's drying your mouth out? Are you sleeping with your mouth open? That's going to cause things to dry out, and again, that's going to cause things to have kind of a different smell. So lots of things that we can look at. Another alternative would be talking actually to like a GI doctor, like an internist, talking to an internist, because that could mean that there's something wrong with your digestive tract that's causing that bad breath. Yeah, a lot of people think that you have to have dental insurance and have to have dental insurance to have dental care, and that's not true. It does make it a little bit more affordable if your insurance is going to help you out with that, for sure. But if you don't have dental insurance, I would still recommend that you come in to see the dentist twice a year. There are options. Maybe you don't get x-rays twice a year. Maybe you get an exam only once a year. Maybe you even just go for your cleaning once a year, which is better than nothing. And you pay out of pocket for that. If you don't have dental insurance, we actually do have an in-office plan that it's like a membership plan, so that you get discounted services and you get two healthy cleanings per year. So here's my thing. In the 10 plus years that I've been practicing, I've learned I don't want to tell anybody what to eat or what not to eat. The big thing is about exposure. How much are you eating, or how often are you eating these foods? So if you're sitting there sipping on Mountain Dew all day long, only eating candy, or gummy, sugary candy, or even like sometimes crackers will just sit in your teeth all day long. So the issue is the exposure that you're getting on your teeth. So the duration, like how long are your teeth being exposed to that? Also, like the pH. So the sodas, the issue with the sodas is that they have a really high pH, and that can change your oral cavity, your oral environment, which is really bad for not just your saliva, but really bad for your teeth. So enjoy your coffee, enjoy your candy, but enjoy your sodas. Just have those at mealtime instead of sipping on them all day long. The goal is to shorten our duration and still enjoy whatever you want to eat. So even me, I'm here drinking my soda. So I want to make sure that you're able to eat and drink whatever you like. We just need to make sure we do that in moderation.